if you have joint pain, I need you to think of a couple things. One, are you actually taking care of your joints more than just your walking and lifting? Are you doing joint mobility? Are you doing range of motion through your joints to maintain the integrity of your joints, because you are going to get stiffer with time and certain joints get used more than others. Then you're going and working out, but your joint may not have full range, and then you kind of compensate, and then some muscles get imbalanced, and then there's this whole thing. So one, are you doing joint mobility? Because you kind of need to. I recommend 10 minutes a day for all mortals who walk this earth. Number two, are you being supportive of your joints? Meaning, do you need to get new shoes? Are you being good to you? Are you chemically inflamed? Is dairy a problem for you personally, but yet you continue to eat it, but you know it's bothersome to you? Or is gluten a problem for you personally and you continue to eat it because then you're getting chemical inflammation within your body if that particular food is irritable to you? So are you eating the foods that irritate you personally? And everybody is different. When people say foods are bad or that you shouldn't eat it, and I'll say for whom, but like if you know you're sensitive to shellfish and you're eating it, don't do that. It's causing inflammation. So mechanically, are you moving your body and doing mobility? Number two, are you protecting yourself chemically? And number three, are you supplementing your life because you're probably not getting the nutrients you need? Are you taking omega-3s? Are you taking magnesium? Are you staying hydrated? Because like if you're not hydrated, what? Your tissues can't function. And the omega-3s help balance out the omega-6s of the standard American diet. And if you are eating oily fish 3 times a week and you are getting that nourished food, great, but most Americans aren't, and so you can be inflamed. I need you not to be inflamed. I need you to be nice to you because you're hurting, but like epigenetics matter. That's what you do. Don't just think it's, oh, I got bad joints, I have a history of bad joints. You might have a predisposition and you might have a connective tissue issue, or you might have rheumatic factor, but what you do matters. Your epigenetics is what you do, and your micro habits every single day bother you. The way you posture your body is the final thing I want to tell you. If you are having hip pain and you're sleeping on your right hip, and then you are constantly crossing your legs, if you're standing and hanging out on that hip, girl, you are pissing your hip off. Stop sleeping on your painful hip. Stop crossing your legs. Stop standing and hanging out on that hip when you are just talking to friends. So what you do matters. Your position matters. What you eat matters. And if you're hurting and you're looking for joint pain relief, these are things that all people can work on right now to help you feel like the best version of you. Hit the plus sign and follow for more women's health and wellness tips. Bye.